Hi, my name is Dr. Arnold and I'm a dentist in Preston, Lancashire. And I've just come across an article which says that there is a county with no NHS places available. So we're going to find out what this county is and what is going on. It says that NHS dental places have dwindled in Britain in recent years. Utterly appalling that an English county does not have a single NHS dental place. This was said by an MP and says that getting an NHS dentist is impossible in Cumbria. Okay, so Cumbria is not too far from where I am, just further up north. And recruitment in Cumbria is difficult. You're always seeing ads for dental vacancies or positions available in the area of Cumbria. So this does sound plausible. So Farron was speaking after the government unveiled its urgent and emergency care plan to help reduce the serious pressures facing the NHS. It'll see tens of thousands of elderly and frail people receiving tailored support at home each month in an attempt to stem the flow of those needing hospital treatment. But Farron was critical of the plan, saying it offered no solutions for the thousands of people forced to go to A&E because they cannot get regular access to an NHS dentist. So what happens is when dental issues are not treated in a timely manner, they get much worse, and it can lead to certain things like infections developing into abscesses and becoming really serious and painful, and people end up going to A&E to get these dental issues sorted. But really, with A&E, it might just be that you get a temporary resolution. You still need a dental procedure to be carried out, whether it's root canal treatment or the tooth being taken out at your general dental practice. So pressure is being placed on A&E and on hospitals when pressure doesn't need to be placed on hospitals, and hospitals can be dealing with other issues instead. So this is why it's important that people can actually see dentists to resolve dental issues. Now, how that happens is another story. Whether we're saying that people need to go get seen privately if they can't find an NHS practice, whether the government needs to intervene in some way, that's another story. But it's best that people are seen in dental practices for dental issues before they get to this extreme. Tim Farron tweeted, more and more NHS practices going private. During a cost of living crisis, it's utterly appalling that many people and families are being left with no choice but to pay hundreds of pounds a year to see a dentist. Today, I challenged the health secretary to intervene. So again, it's either that the government get really serious about funding dental care for the population, for the nation, or it's coming to a point where the government says that, you know what, there is no budget to actually provide dental care under the NHS, and people just need to be seen privately. So it looks like that discussion needs to be had. Is there going to be proper funding placed towards NHS dental care, or is the government saying that really dental care needs to be sorted out by each family on a private basis? So in the article, it goes on to say that last week, another Cumbrian dental practice in Grange-over-Sands wrote to all of its 5,800 patients to say they had been forced to quit the NHS too. There is now not a single NHS dental practice anywhere in Cumbria available. So what will he do to fix an NHS dentistry crisis that leaves a family of four having to cough up an extra £1,000 a year during a cost of living crisis to get access to dental care they've already paid for through their taxes? So it looks like there's no NHS places available in Cumbria anymore. There's a reason why dental practices are choosing to go private after all these decades of having offered NHS dental care, and it's mainly down to the fact that the contract that's handed to dental practices is just not viable financially. In some cases, it will actually cost the practice more to treat somebody than not to treat them when they're working under the NHS contract. So for a business, that's the quickest way to shut down, close, become bankrupt, because in a business, you need finances to be able to actually pay staff and for work to get carried out. So if the contract is not actually allowing businesses to be viable dental practices, then the NHS doesn't work for dental care. So the right funding is needed for NHS dental care to work, or as a nation, we have to come to the realization that the government isn't going to put the funds needed to make this work, and that private dental care is where things are heading. So what seems like it was a sensational headline is actually true. The county of Cumbria now is not taking on NHS dental patients. Looks like practices have gone private there. And I just see this trend continuing across the rest of the country over the years. More dentists moving private because working under the NHS, the pressures, the stress, it just doesn't make for a long career in dentistry. And we're going to see more of this happening. So let me know your thoughts in the comment section below. I know it can get heated where people think that, it's just the greedy dentists, but there's reasons why dentists are choosing to say no to NHS dental care because it's just not working in terms of them being able to actually have a viable income that will support them and their families, and the stress and the pressure that comes with that. So the contract isn't working for dentists, for dental practices as businesses, and it looks like unless the government can fund NHS dental care properly, we're going to be saying goodbye to NHS dental care. I'll catch you guys at the next one.